And I'd like to welcome everyone to our webinar today entitled Using Learner Data for Curricular, hosted by Dr. Sherry Jimenez, Assistant Dean for Educational Development, Marian University College of Osteopathic Medicine. Sherry Jimenez is the Assistant Dean for Educational Development at Marian University College of Osteopathic Medicine in Indianapolis, Indiana. Dr. Jimenez specializes in student learning outcomes and assessment, curricular improvement, faculty professional development, strategic planning, and accreditation management. Dr. Jimenez has received awards and grant funding in support of her passion for service, curricular improvement, and student success. She is the 2013 winner of the St. John Fisher College Ralph C. Wilson Jr. Exemplary Performance and Service Award and the 2010 Nazareth College Excellence in Management Award. Her dissertation research focused on curricular improvement and was a study of geriatric content in the U.S. Doctor of Pharmacy degree curricula. Before we begin, I have just a few housekeeping items to go over. Sherry, if you could advance the slide for me. If you have specific questions, we encourage everyone to type them through the questions feature of the GoToWebinar control panel, which should be on the right-hand side of your screen at any time. We're going to have a chance to answer all questions at the conclusion of the webinar. Also, at the conclusion of the webinar, you should have a quick survey pop up for you. We encourage everyone to fill out this short survey if at all possible, so we can continue to provide relevant content at all of our presentations. Go ahead, next slide, Sherry. We also would like to make everyone aware of an upcoming webinar entitled Creating Buy-in to Establish a Culture of Assessment, presented by Dr. Karen Bobak, Dean of Chiropractic Education, New York Chiropractic College. Dr. Bobak will be presenting her webinar regarding building an assessment-focused culture, p.m. Eastern. And yes, just because I know everybody will ask, we are recording today's webinar, and all attendees and registrants will receive a follow-up recording. Thank you so much for attending, and please.
Share what we're doing here at Marian University. Let me just advance these slides, and I do look forward to Dr. Karen Bobak's presentation. I do touch on will be a good segue for that training. Okay, a few quick tidbits about Marian University College of Osteopathic Medicine. We like to refer to it as MUCOM here. We're a new medical school. We are actually the first osteopathic medical school in Indiana and the first Catholic osteopathic medical school in the country. We opened our doors just last August. We offer a traditional 4-year DO program here. Our curriculum is a competency-based integrated curriculum, and we are iPad exclusive. So our IT department configures and supports the iPad for students. We distribute them during orientation week, and then we provide training on all of the technology we place on the iPads. So they come equipped with library resources, textbooks, our learning management system, which here is Canvas, and SoftTest M, which is the ExamSoft component needed for students to take exams on the iPad in a secure environment. I would like to start off by saying that while I have experience with using ExamSoft in now obviously I'm an osteopathic medical ed, I look forward always to sharing ideas with other schools on how to use the technology in the best way possible. I think what you'll learn as you talk to other folks on the community is that no two schools are exactly alike in how they use ExamSoft, which I think is actually the beauty of the system and allows for very constructive conversations amongst users as we all journey to continuously improve how we're collecting and using performance data for student success and curricular improvement. So in an effort to share what we're doing currently at a new OM school, we just welcomed our second class actually last week at orientation. I plan to cover the following, and by the way, I have violated the PowerPoint 6x6, 6 bullets, 6 words on this particular slide. Apologies, and I will not be doing that again during the course of this presentation, I promise. I would like to introduce everyone participating to developing a coding structure to accompany test items, written and practical, that can be used for curricular quality assurance purposes in ExamSoft. You'll hear me using the word coding and category. There's a category structure, and I'll tell you more about that in ExamSoft, and so kind of the jargon we use is coding and a test item to a category. Right or wrong, that's how we talk about it here at MUCOM. I'd like to describe how category development can be applied across multiple disciplines in undergraduate, graduate, and professional education. I will again touch on touching on creating a culture of evidence and involving key stakeholders in that process. And I don't remember if Stephanie mentioned, I think I heard her say it, there will be some audience interaction here. It will take the form of one poll that I'd like to do just to understand where folks are at with coding. And certainly if you're exploring exam, not currently using it, feel free to just respond not at all when we get to that portion. And of course there will be a Q&A at the end of the webinar. I think we can all agree that our key stakeholders are students, faculty, in the form of obviously the instructors and our course directors. There's our administration, accreditors, and so on. I think we all pretty much have a similar group of stakeholders that we're serving. Going out of order here, but I really would like to clarify early on that we assessment folks all share this goal of creating this culture of assessment, or what's quickly becoming a culture of evidence. I guess that's the new buzzword. Assessment isn't always a very welcomed word. We're always exchanging ideas and at doing this. And faculty administrators are extremely knowledgeable and astute, therefore including them in the coding process of test items that I'll describe in a moment, and then simply supplying them with their data has been for us the best approach in motivating our comrades. So we have been able to identify banks that are sharing how they're coding, how it organizes their data in a way that allows them to draw conclusions about content, delivery, student progress, and test item quality. So I start here because I think it's important as I describe this process that we're envisioning who we're serving in catching and releasing performance data.
Sherry?
Yes, I'm
so sorry, we're not advancing.
I'm sorry about that. Let's do that now. This was just my crazy long slide, and these are our stakeholders that we just talked about. And here we go. Apologies for that, folks. So before we continue, if I may clarify for any newcomers and explorers of ExamSoft, when we refer to test items, we're talking about written exam items as well as rubric evaluation criteria. Written exams are multiple choice questions, short essay, short answer. Rubrics can be used for essays and papers, as we know, as well as practical examinations. In osteopathic medical education, we use both exams and rubrics for written and practical aspects of the osteopathic manipulative medicine portion. Biomedical science exams are predominantly written exams. Okay. Here's our poll. And are you opening that now?
Yep, it should be up for everybody to see.
Perfect. So the question is, to what extent do you currently use categories to code your test questions and rubric evaluation criteria in ExamSoft? Again, if you're here exploring today, it's okay to put not at all. I just want to get a sense for, we're all kind of at different points in the process of doing this, so it's always nice to know.
And as of right now, 81% of the audience has voted, 72% at not at all, 16% at moderately, and 12% at extensively.
Okay, fantastic. Okay, so ExamSoft possesses functionality that allows you to develop this coding or category structure whereby each test item created can be tagged. There are a number of levels that can be used, and it really depends on the school and the program. Some schools have fairly prescriptive to moderate accreditation standards they manage to in structure in their category system. Healthcare, professional education program disciplines typically find it useful to test items also by systems and disciplines as well. And so what I've put up here are just some examples of components of a coding system and a picture of our high-level structure. So, you can start at the university essential outcomes level, program learning outcomes, and this is where, again, I really believe this coding structure can be designed for undergraduate, graduate, and professional education programs. It's all in how you would like to, what you'd like to capture. Item that was created by an instructor and then coded to the categories that we've developed. I've expanded that listing kind of in the center here. I've blacked out the instructors for anonymity, but it looks a little busy. But the takeaway here is that now what you can do is run reports on all of these categories, and some of these may be very obvious to you, and maybe some others are not because they're more internal. But basically, this gives you the opportunity now to filter and run reports on any of the codes that you've actually put in the coding structure. It's particularly useful for the College of Osteopathic Medicine, since we have an integrated curriculum, to be able to code to this level. The same coding structure can actually be applied not only to a written test item, but also to your rubrics. So it's not that you have two separate coding systems. And this is an example of what that might look like. This is a very simple example. We are in the pilot stages of utilizing the multiple grader rubric in ExamSoft, so I didn't want to get too heavy on the codes here, but I just wanted to point out that those are two codes that are in our main structure. In osteopathic medical ed, we code all items to the National Board of Osteopathic Medical Examiners, Fundamental Osteopathic Medical Competencies. That's a mouthful, but I didn't want to throw any acronyms at you without defining those. So that's first and foremost for us. These competencies are mapped to each course's learning outcomes. And as I said, we do code to systems, disciplines, also learning domains, and we do to the affective and psychomotor. The categories you see blocked out here, we actually created a few in error. We are new and continuously improving, and so I didn't want to distract you with some categories here that might not make sense to you. So keep an eye pointing to year one. I'm going to hone in on something in there to demonstrate course-specific coding we can do here and how it facilitates reporting. Okay, so you may remember previously on the levels of coding slide, I listed course director specific methods of coding. Faculty and course directors are invested in this process because they create their own course specific coding beyond the high level codes I mentioned. Examples of how they might structure their course codes would be key topics or words and or objectives. We do not provide exam questions to students, so this helps them to ascertain where their strengths and opportunities for improvement lie when they. You'll notice that in addition to topics, in the center here, Intro to Clinical Medicine, our director has actually been innovative enough to also track by learning venue, which is depicted there. I point that out as well as the cardiovascular subtopic here to show you a simple mini report driven by these two categories, and I'll show you that next. Sorry about all these are kind of our internal numbers, but I think you get the gist of the learning objectives and to the extent to which we can grab topics and do a drill down, and that's what I want to demonstrate here. Okay, so one of the examples that I want to too heavily into reports on this particular webinar, and I'm happy to do that at a later date. You may or may not ever run a report on just one subtopic or keyword like I'm depicting here, but this demonstrates what information can be yielded over time across one or many categories. We've only run this course, keep in mind please, one time, so again we have a low number of assessments and items at this point. Nevertheless, again, we get an idea of how the group has fared thus far. So you've got number of assessments, number of items associated with this specific cardiovascular system objective, and then with the group, how the group fared, and then I point over here to audible heart sounds, which was also another innovative thing that we did. We actually uploaded the heart sounds into ExamSoft, and students were able to take an exam and answer questions associated with the different sounds. And as you can see here, so we did that once. That was a pilot. It depicts how many items were on that exam and how the students fared. So what are we doing with all this data? Well, informed of their performance starting with exam 1 and on. We give them as much information as we can. They're furnished with a strengths and opportunities report and what we have coined a question by question report. This report actually doesn't provide question stems, but it does provide in lecture order all relevant topics students were evaluated on for that exam and their associated objectives. So I may not be doing the explanation justice, but if there's interest, again, I can expound on that in a future webinar. We have a coordinator of examinations here, we're very lucky, and she furnishes advisees score reports that are updated with this for each exam also. The report also contains some baseline admissions data to give advisors a holistic look at their students. All score data is also furnished to our progress committee. Our students have a lot of people looking out for them in terms of their progress and their success. And we've also begun running correlations between admissions data, for example, science GPA, total GPA. We do multiple mini interviews here, so those scores, we're starting to run correlations between that and the ExamSoft performance data. The data collected also allows us to look at exam questions and curricular quality. One way we do this is with an item analysis, and we can pull data to support this activity in report form from ExamSoft. So that helps us understand how good our questions are. We can look at point by serials, discrimination indexes, KR20s, group averages, for example, that can tell us how difficult the question was, how students fared on a question, etc., and also aids us in our looking at whether we coded items adequately, determining whether modification to our structure might be warranted, whether we need to decommission an item altogether, maybe the question wasn't written correctly, had more than one answer, wasn't covered in the teaching. So we get a good feel for how well we're assessing what we are teaching and vice versa, because we've got this map, so to speak, as a result of the coding structure that we're employing. And I think I have time here. So I wanted to squeeze in some lessons learned as a new school embarking on administering online examinations. First off, the goal was to have all items coded before exams were created, and in some cases as a new school and with competing deliverables, getting out of the gate, this was not always possible. So we've learned to be patient, and the good news is that even if an exam is administered prior to coding, once entered, the coding is in fact applied to those assessments. So ExamSoft has a magical retroactive, fantastic. In terms of ease of implementation, setup obviously takes time, but in the end, embedded assessment will be less taxing on the faculty. The key for us has been to consult closely with our course directors, especially with regard to our competency-based coding, and also conducting pre and post meetings with the exam coordinator to plan for administration and coding. We also conduct a post-course meeting also to document any course-specific lessons learned with regard to the coding, the administration, and so on. And I just wanted to say again, and this is really part of building that culture of evidence, in the ranks is faculty appreciate hearing who are willing to try new things and or take some risks with coding or exam administration. They're very willing to share what they've done, how it worked, and if they'll continue or discontinue that activity or approach. So they become the advocates, and this helps with developing this culture. So in terms of our plans for the future, I'd like to share two sayings that keep resonating, and they may be considered cliche at this point, but they're so applicable to this journey. It's a journey, not a destination. That's the first one that I'm constantly. And also, it takes a village. So we continue to improve our coding systems, and we will always do that. I say closing the loop on coding. I mean, I don't know if that will ever entirely close the loop. I think we'll continue to streamline and get it in pretty good shape, but I be looked at and improved. We also want to continue to streamline the quality improvement process for our test items in terms of peer reviewing and making sure that we are giving the best quality questions to evaluate our students. Again, longitudinal reports, which I really believe is a your coding system is we plan to provide our students with longitudinal reports and just haven't done that as a new school because we want to make sure. And then, as I said earlier, we are planning on exploring the multiple grader rubric, and I believe we may have conducted a pilot this week. I just haven't been debriefed on that yet, but we are definitely looking into that for the OSCE environment, which is the Objective Structured Clinical Evaluation. Are actually that's not I'm sorry, I meant to say, well, we're going to do it for OSCEs, but we're also going to be doing them for the osteopathic manipulative medicine. There's a lab that they do, and they actually do a practical rotate to different stations, but they also have multiple graders, you know, obviously a different person at each station, and so that was kind of difficult to do last year, and so this is open to assign these rubrics to multiple graders and have them grade one individual on the different stations depending on what station they're in. So we're very excited about that. And that's all I have. I feel that I went fairly rapidly, but I hope that it covered questions that you may have had, and I'm happy to take questions if we have time for that.
Absolutely. Thanks so much. Several questions that have already been posed. Again, I'm going to go ahead and put this out there. If anybody else has questions that they would like to address to Sherry, go ahead. Now's your opportunity to type those into the questions area of the GoToWebinar control panel on the right-hand side of your screen. If you'll type them in there, I'll be able to answer them. Let's go ahead and dive right in. The first question is, how do you run a longitudinal report for a course that has had 3 assessments?
Well, we could run it, but I mean that's, you know, not entirely enough data, which is one of the reasons why we haven't really embarked on doing that at this point. I mean, you could certainly, I mean, if you're asking me logistically if the system will do it, yes, it will, but certainly you want to have more data in the system before you start running those.
Great, thank you. The next question is, how many students are in your school and how many staff are in assessment?
We have, I'm sorry, was the first question how many students per class?
Just how many students in general?
Okay, well we have 2 classes here right now, and they each consist of 162 students, so right now we have 320 students. And the assessment is right now, we have an exam coordinator, a director of educational assessment, and then I oversee what's going on in assessment. So you could say 3. But everybody's involved in the process. So all of the course directors are involved, faculty. Some of the faculty are creating their own questions. Some are more involved than others depending on workload, etc.
Great, that actually segues really nicely into the next question, which is how involved are faculty in the process, and is this mandated or optional?
They're very involved in the process. The way our curriculum works, kind of blocked, so we don't have multiple courses running at one time. I mean, we always have Intro to Clinical Medicine running, and we always have Osteopathic Principles and Philosophy. We have that running, but in terms of the other courses, they run kind of one at a time. So at any given time, certainly any of the faculty that are involved with teaching that course are involved with providing test items. And some course directors will put them into the system themselves, but we are set up here to do importing of the test items. We have our exam coordinator that is doing that. She's also trained 2 of our administrative assistants, and they're also assisting faculty, but faculty are very welcome to get in there and do what they would like to do, and we're constantly offering training, but we also understand as a new school, again, we've just started year 2, so this will be the first time that we're getting this mass amount of questions in for these particular courses this semester and then this year. So we're giving them as much assistance as we can, but everybody is being trained and everybody is welcome to get in there, and a very large percentage of people that are interested in doing that, but it's a different group of people depending on the time of the semester and what course is running. I hope that helps.
Yeah, great. Thanks, Sherry. The next question is, has your college created categories to capture specific exam persistence?
No. I would have to say no, and that's interesting. I would like to know more about that, actually. What
yeah,
is that?
It's an interesting question. I don't know of any clients doing that, but I would love to hear about one.
And I guess exam procedures, I'm not sure what's meant by that, but as I showed in the coding structure, there are some people that are coding to an actual venue, depending on the venue. And then we have a number of really interesting ones in the asymmetry portion of the osteopathic manipulative medicine, but of course that's very specific to OMM, but I think what he's doing is real innovative too. But I'd love to know more about the procedures piece and where you're going with that, whoever posed that question. That's interesting.
Okay, next question is, what are our faculty are having difficulty tagging items to these categories?
For Bloom's, what we've done, and this is something I learned from my previous experience in pharmacy from Jane Souza, who you may or may not know. She's the assistant dean over there, and what we had done when we first implemented ExamSoft was we collapsed it into knowledge, application, and synthesis. And that is what we're doing here. So we only have the 3. It just kind of, it does, some of these do, the knowledge and comprehension kind of overlap a bit, the application and analysis overlap a bit, as do the synthesis and evaluation, and we found that very useful in pharmacy, and so that's what we've implemented here.
Okay, next question is, would it be possible to have a longitudinal exam blueprint for a course that has had more than one assessment, possibly 3?
A blueprint in terms of, if you mean can you run the report, yes, you can run a report.
Yeah, that's what I was getting from the question as well. But
yeah.
Yes, you can. Yeah, you can.
You can do it. You can do it. It's just, again, you have to. The concern is, and what we've experienced. Actually, previously what I experienced is when you run a longitudinal report and you don't have a lot of data, there could be a particular area that, say, the student only had one question. There were three or 4 assessments and one question in that particular area. Maybe it's hypertension. Well, if they got that question wrong, it's going to give them this, it's going to make them look like they were not very successful. And you know what I'm saying? It's kind of it's a little bit skewy. But I think if the students understand and know how to read the reports, I think it's okay to share.
Great. Next question is, do you code against the National Competency Framework or/and an internal curriculum mapping system?
Well, both, because we're coding to the National Board of Osteopathic Medical Educators fundamental competencies, as I indicated, and that is how we have created, basically that's how we're mapping. We're using that to map, so we're making sure that everything is mapping up to that.
Okay, I'm going to paraphrase a couple of these questions because I have several people asking basically the same thing. But a lot of people are asking, how difficult was it to initiate your tagging and category structure? It tends to be a little bit of a rabbit hole. So
right.
How hard or easy was it for your program to decide on what the competencies were and stick to them?
Well, first of all, here our dean's vision was to go to MBOME, and quite honestly, not most of the biomedical science folks weren't real big fans of that because it's very difficult to map to that. But this is his vision, and one of the things we do is basically make recommendations if there's not a comfortable way in which we can actually map biomedical science evaluations to those competencies. But the way, to back up, the way in which I started here, I had a pretty good idea when I got here, obviously, what the dean's vision was to do that, but also I just lost my train of thought. I had kind of a good idea of how I thought we might want to do this, and so the way I started was I got with the faculty and gave them an idea of what I thought it would look like, and then together we worked on what we thought we refined it, so we had the systems and the disciplines, etc., and then we determined that there were a set, and I'm sorry if I didn't mention this, but we determined that there was a set of codes that everybody needs to code to, and those are those MBOMEs. I feel comfortable I can use that acronym now because I've said it a couple times. So the MBOME competencies, those are a must. Systems and disciplines are a must. Learning domains are a must. There's a few of them. I think there are like 5 that every item must be coded to, and everyone has worked with us to do that, and we've definitely had to kind of double back and do a little bit of a gap analysis and close the loop on that, which is what the Director of Educational Assessment has done here. Beyond that, again, per course directors we've given them the freedom to be able to track their items in the way that they want for their specific content. And so right now, everybody is each course director will create their own codes, and then we will furnish them the data in the way that they want, or they can pull the data themselves. So I hope that answers the question. And we're continuously improving. I'm sorry to interrupt. We're continuously improving, and we did have a retreat this summer, and that's one of the things that we talked about extensively was how can we make it better.
That sounds great. Thanks, Sherry. This is the last. I have one more question so far, so if anybody has any other questions, now's your last chance. If not, we'll go ahead and wrap things up. The last question I have is, you mentioned your program only uses iPads. How have students reacted to this initiative?
Quite favorably. We haven't had any pushback at all. I think they're so technologically savvy, so they pretty much, I think, know it. They know how to do it better than we do. But it's been very favorable. The only thing that we've run into, and it's not even an assessment concern, is there are some students who are accessing textbooks, but would prefer to have the option of accessing those or getting a hard copy textbook, and we don't do that here. We're all electronic, and so we're actually revisiting how we might give them that choice. But it's been very favorable. We've been doing that. We've been doing it for a year now, and exams have gone really well. And we've got recorded the lectures are recorded, and students can access those from their iPads, and so they have. We've had no real pushback.
Great. I did have another question come in while we were doing that one. Do you have any examples of, is there an example of the data change, or I guess what are some of the outcomes that you've received in the past couple of semesters by using the data?
Oh my goodness. Let's see. We just had our retreat. I'm trying to see if I can pinpoint one specific thing right now. Oh my goodness, I feel on the spot now. It's escaping me.
Yeah, it's a rather big question, isn't it?
Yeah, well, it is, and my goodness, I'm trying to think if there's anything specific that we discussed. We are just looking at all, well, I shouldn't say just. We started in, what was that, the end of July, looking at the data. So right now, what has jumped out at us just recently?
I feel like the biggest change that most of our clients experience that is kind of an ongoing thing is through the use of student remediation. And you mentioned that earlier in your presentation, how your students are getting reports, you know, letting them know how they did on their exams immediately after the exam. And I mean, that's kind of an ongoing thing. It's not something that, you know, you'll see one huge spike, you know, after a year or even 2 years. But if you look at the data longitudinally, you can see the change gradually, you know, affecting over time. But definitely something to watch.
Yeah, and I would say I think why I'm at a loss too is because, you know, we've got the data, and now we're just in this, and then, you know, we'll need to look back at the data again to see what has been the net effect, and we're just not there yet, I guess, because we're new. So it's hard for me to, you know, I don't have some tangible things that I can share at this moment. But I will echo what you said in terms of the remediation. I think that's been extremely helpful, and students have shared with us. I'll be honest with you, the way in which, and again, this is coding, you know, a contingent upon how someone is course directors are coding. Some of those strength and opportunities and what we coin question by question reports that we give to students, some have been more helpful than others in helping them to self-remediate, and that's a function of what the course was a big conversation at our retreat this summer, and how we can streamline that and make that better.
Great, thanks so much, Sherry. We're
Sure.
going to go ahead and wrap. We're going to go ahead and wrap everything up now, everybody. Again, I'd just like to reiterate that this webinar was recorded. So if you are here, or if you had colleagues who registered, and we will be sending out an email in the next 24 hours that should have a link to this recording that you can share with any of them. Also, just as a reminder, as soon as you close out of the webinar, you will get a pop-up on your screen with a couple of questions, just a brief survey. We would really love it if everybody would take just the 2 minutes to fill that out quickly for us, so we can continue to provide relevant content for everybody. Again, we'd like to thank you all for being here. We know you're very busy, so we appreciate you taking time out of your day to chat with us about assessment and curricular quality improvement. Thank you so much, Dr. Jimenez, for being here and sharing your thoughts with us. And we'd love to see all of you at our next presentations in the coming weeks.